Turning now to the COVID-19 pandemic, Canada's Chief Public Health Officer is offering a word of caution over expectations for a possible coronavirus vaccine.
That vaccine is a very important aspect of the response going forwards, but we can't at this stage just put all of our focus on in the hopes that this is the silver bullet solution. We're planning as a public health community that we're going to have to manage this pandemic, certainly over the next year, but certainly maybe planning for the longer term of the next 2 to 3 years.
Dr. Theresa Tam made the comments amid growing hopes that a vaccine could be ready by the end of the year. Right now, there are over 150 potential vaccines in development around the world. 7 of them are in the final phase of testing before getting approval for mass distribution. For a closer look at all of this, we're joined now by Dr. Samir Gupta. He's a respirologist, associate professor at the Department of Medicine at the University of Toronto, and he joins us every Wednesday, and he joins us from Toronto. Okay, Dr. Gupta, let's try to unpack some of the timeline concerns over this. We heard Chief Public Health Officer saying it could be 2 to 3 years before a vaccine is in wider distribution. What do we make of the timeline?
I think, John, she's introducing a little dose of realism, maybe some might say pessimism, into the discussion. Like you said, we have 7 vaccines now and counting in human trials, and that's very encouraging. And the timeline on this has been unprecedented. Typically it does take years to develop a vaccine, but we've had a concerted global effort. So we have progress like we've never seen before for a new virus and a new vaccine. We know that the vaccines that we have so far generate the right types of antibodies. They're called neutralizing antibodies. They seem to be in sufficient numbers. They're in numbers that are comparable to people who get the real infection. Those are good things. We also have, for most of those vaccines in human trials, we have data in monkeys that show that when you give those monkeys the vaccine and then you challenge them with the actual virus, they are protected. So those are all good things. What we don't know for any of these vaccines is how long that immunity lasts. That's the big unknown here. And the risk there is that this is a novel coronavirus, but coronavirus is also the cause of the common cold. And people know that they can keep getting the common cold. And the reason for that is that once you get it, you have antibodies, but they just don't last. And similarly, vaccines for the common cold haven't panned out. So if we get into this issue where the antibodies are there, but they don't last long enough, we'll have a lot of difficulty eradicating the virus with these vaccines. And I think that's, to some extent, what she's getting at, is that we just don't know about how sustained that effect will be with these vaccines.
A couple of other aspects to unpack in terms of what Dr. Tam had to say. Even if and when there's a vaccine, she implied there might not be enough for the population, and that will imply that the coronavirus could be with us for a variety of reasons. Are the protocols, the hand washing, the masks, even the distancing that we've all had to do in the last 5 months, is that something that may have to continue in one form or another for years to come?
It all depends, first, on how soon we have a vaccine that's effective. Second, this question about how effective it is and how long that immunity lasts. But the third piece is even just the practical reality of how do you get that vaccine manufactured and distributed once we have an effective vaccine. And, we have, once you have, let's say we're lucky and we have something that's shown to be effective in the next few months, you then have to generate 35 million doses, and you have to have an apparatus in place to get those doses distributed. There are incentives now with this Operation Warp Speed that they have in the United States that are encouraging companies to actually manufacture these massive quantities of the vaccine even before the trials are finished. So to take on that risk and have that supply ready as soon as the trials are shown that the vaccine is effective. But then you have to distribute it, and getting 35 million people to get this dose of vaccine, and maybe 2 doses, maybe more, is going to be a logistical challenge. That's something we need to work on now. Even if we're giving 100,000 doses a day, it'll take a year for Canada to be vaccinated. So we have to think about, even after a vaccine, how long is it before everybody is safe and everybody's received that vaccine?
All right, the other hurdle in all of this, say we get the vaccine, say we're able to distribute it and all of that, but a new poll by Angus Reid suggests that while about half of Canadians would be ready to take a vaccination as soon as it becomes available, 3 in 5 are worried about potential side effects of any new vaccine. So Is there room for skepticism here, or is this a case where if is one available and it's proven and it's distributed, we better all take it?
So, as a healthcare worker, I'll be lining up to get this vaccine. But a lot of my patients are asking this question. They're saying, Doc, how much information are we going to have about long-term side effects? And the reality is we're just not going to have that information. If you look at one of these leading candidates, if one of these pans out, we're going to be able to look back at patients who had in the phase 2 trials who had this vaccine, and we'll have maybe 6 to 9 months worth of information for that small number of patients to see what happened over that medium term. For the much larger number of patients in the phase 3 trial, we'll have really only short-term data. So we'll know it's effective on the short term. We won't know anything about possible long-term side effects. What we'll be doing is relying on our knowledge of sort of the mechanism of how vaccines work, and understanding that vaccines that are very similar and work in a similar way have been shown to be effective in millions of people over decades and decades. But we won't have it for this particular vaccine. And to be fair, some of the vaccines that are being trialed right now are quite novel. They work through different mechanisms. And one of those, as an example, would be Moderna's vaccine, which is an mRNA vaccine. There have been no mRNA vaccines approved for human use before. So we are dealing with new technologies, and there is some uncertainty there. The reality is that once we have an effective candidate, people are going to have to decide if it's more risky to actually not get the vaccine if there's still community transmission going on. And I would argue that it would be more risky not to get the vaccine, given our understanding of the mechanism of how vaccines work and how safe they are.
Yeah, so the public education process continues. Dr. Gupta, I want to thank you once again for your time. Really appreciate it.
Thank you. Take care of yourself.
Will do. You too. Dr. Samir Gupta speaking to us from Toronto.